Chapter 6. First Aid. We already know that accidents can occur anywhere and at any time. So we should be alert and careful all the time. First Aid. The immediate help given to an injured before the arrival of a doctor is called first aid. If first aid is given timely to a patient, it can help in saving his or her life. Before giving first aid to anyone, we must wash our hands with soap and water to clean them and to remove any germs present on our hands. Let's learn how to give first aid in different situations. Cut and wounds. Never neglect any cut or wound, however minor it is. It can become an entry point for the germs to enter our body and cause infection. Wash the wound of any dirt. Clean the area with a clean cotton and an antiseptic solution. Apply an antiseptic cream. If needed, tie a bandage over the wound. Place a thick pad of cotton over the wound and press it firmly to stop bleeding. If necessary, apply a tourniquet to stop bleeding. A tourniquet is a strip of cloth that is tied tightly around an injured arm or leg to stop bleeding. If the skin is cut by a rusted object, then germs may enter and cause tetanus. Immediately, consult a doctor for an antitetanus injection. Nosebleed. Make the patient comfortable with his or her head held back. Firmly press the side of the nose that is bleeding. Put on ice pack over the nose to stop the bleeding. Ask the patient to breathe through the mouth for some time and not through the nose. In case of heavy bleeding, take him or her to a doctor. Fact file. The best way to prevent ankle sprains is to maintain good strength, muscle balance and flexibility. Sprains. A sprain is the tearing of tissues around a joint. The affected area can swell up and the skin may become discolored. It can be very painful. Apply an ice pack on the affected area to reduce the swelling. Keep the affected area still for some time. Wrap a crepe bandage to prevent unnecessary movement and to give support to the injured joint. Fractures. A fracture is the breaking or cracking of a bone. The affected area swells and is very painful. Such cases need specialized medical attention. Yet we can do a few things to provide some relief. Keep the fractured part still. Apply a splint to give support to the broken bone and try to avoid unnecessary movement. A piece of wood or cardboard used to hold a broken bone in position is called a splint. To give support, a sling can be used. It is a bandage passing over the shoulder to support an injured upper limb. Take the injured person to a doctor as soon as possible. Burns. Very hot objects, boiling water or steam, etc. can cause burns. In minor burns, the skin turns red accompanied by a painful burning sensation. We should give first aid only in case of minor burn. To treat severe burns, immediate expert medical help is required. Either dip the affected area in cold water or allow cold water to flow over it. Apply an ice pack. Apply an antiseptic lotion or cream. Alternatively, you can make a paste of baking soda and water and apply on the burnt area to get relief from the burning sensation. In case of severe burns, put the baking soda and water paste as a wet compress over the affected area until the medical help arrives. In case of chemical burns, wash off the chemicals by washing the affected area with cold water. Cover the area with gauze as you wait for the doctor to arrive. Fact file. Aloe vera gel can be applied to heal small wounds, burns or ulcers. It forms a protective coating and helps in healing. Fire safety. Fire is very useful for us, but if unattended, it can turn into our biggest enemy as well. To keep safe from fire, we should observe the following rules. Call the nearest fire station if you see dense smoke of fire coming out from a house or a building. Use a fire extinguisher or throw sand to put off fire. Do not play with matchsticks or lighters. Keep inflammable articles such as petrol, diesel, kerosene, etc. at a safe distance from the kitchen burner or other fire sources. If a person's clothes catch fire, prevent him or her from running in panic as air will feed the fire. Ask the person to roll on the ground. Cover the person with a heavy blanket as the fire can be doused by cutting off the oxygen supply. Animal bites. Dogs, cats, bats and wolves carry the rabies virus. When such animals bite a human being, they transfer this virus to him or her. Such a person can then become infected with rabies. So, animal bites should be treated immediately. Wash the wound with soap and water to remove the animal's saliva. Apply an antiseptic lotion or cream on the affected area to prevent infection. Call the doctor immediately for further treatment. Fact file. Cat bites tend to be more dangerous than dog bites. Cat bites are more likely to lead to bacterial infections that are hard to treat. Snake bites. Certain snakes are poisonous. They inject poison through their fangs when they bite someone. Therefore, treatment should be rapid as poison can kill. Apply a tourniquet just above the affected area to stop the poison from mixing with the blood and spreading to other parts of the body. Rush the person to a hospital. It is indeed wise to take precautions while walking through grassy areas and other places where snakes are found. Wear high boots for protection from accidental snake bites. Poisoning. Sometimes household things can be poisonous too. Some examples include naphthalene balls, medicines, paints, detergents, phenol, etc. So, follow these safety rules. Before taking any medicine, check its expiry date. Discard medicines that have crossed their expiry date. Thoroughly wash fruits and vegetables to clean them from any chemicals, pesticides or dirt. Make the person vomit if he or she has consumed any poison. Rush him to a doctor. We must always be prepared to face accidents as they do not warn us before occurring. Remember to always keep important telephone numbers with you for any emergency. Things to remember. Accidents occur due to our carelessness. First aid, if given in time, can help in saving a person's life. Never neglect any cut or wound, however minor it is. Sprains and fractures can be very painful. First aid should be given only in case of minor burns. Fire is very useful for us, but if unattended it can turn into our biggest enemy. Dogs, cats, bats and wolves carry the rabies virus. They can transfer the virus to a person through their bite. Some snakes are poisonous. They transfer the poison through their fangs when they bite someone. Household things like paints, detergents, phenol, etc. can be poisonous too.